started your timer and here is your question.
Yes, I start, madam.
Just 10 seconds, please. Right, so if you have read and understood, considering it procedural skill station, kindly begin with your wound debridement.
I am in operation theater, and as we know that patient is in general anesthesia. First of all, I will check the identity of the patient. Then I will check the mark of the wound, that which limb is affected, that is left leg, left thigh. Then I will check the consent on the file of the patient. After that, I will check the X-ray of the thigh, that is there any fracture and any metal pieces in the wound. Then I will check the WHA safety checklist. And then I will prepare for myself. I will prepare the gown, scrubbing. Then if the patient is already scrubbed, it is okay. Otherwise, I'll have to scrub and clean and wrap the patient. Then after that, I will apply the tourniquet, which I do not apply. It is present. I will check the equipment for this procedure, which is already present, and all the equipments are there most probably. And then first of all, I will remove the contaminated things like stones, metals, and debris. After that, I will check the extent of the wound. How is the extent of the wound? And I will remove the non-viable necrotic tissue. And as well as I will irrigate the wound also. And after irrigation, I will, and cleaning the wound and complete and excise necrotic tissue. Either I will do the more excision of the wound. I will pack the wound by the pyridine or so gauze piece or alginate dressing, which is available. I will pack the wound and or negative pressure dressing. After that, I can, before it, I can take the pus tissue swab for culture and sensitivity also and send to laboratory. And after packing, I will remove the, before packing, I will remove the tourniquet and check any bleeding. Is there any bleeding or not? Then I will pack the wound and negative section. Then I will discard the sharps, blades, needles, etc. After that, I will remove the tourniquet. I have already removed the tourniquet. Then I will give the post operative orders. Like I will give the injection antibiotics. Will be given. Antibiotics can be given at the start of the operation, and I will also check the tetanus status, and I will check the wound after 24 to 40 hours to redo the operation in the operation theater.
Are you done?
Yes, madam.
So
completed.
Okay, for approximately 5 minutes were still left. Right, my question to you would be, why you decided to check tetanus status so late? Shouldn't you be checking it before?
It can be checked before, but I can check at the end because it has no effect of my debridement. Either I give at the beginning of the operation or at the end of the operation.
Okay, can you please tell me if you have, if I've missed, correct me, if you had examined the wound, and what did you see, and how you removed, and what you repaired?
On examining the wound, I will check the wound status, infection, tendons, nerves, vessels. I will check it, and
it's a
I will-
dirty wound. So
dirty wound.
how would you remove the dirt or the things?
I have told you that I will by the forceps. I will remove the
With
by
the help of
forceps,
okay.
forceps, and I will irrigate. I will irrigate.
Yeah.
Irrigate. Then I can be removed. Suction by suction, I can remove.
Yes. Right. And if you look deep inside, there'll be some tendon which would need to be repaired. How would you repair them?
Tendon in the dirty wound, after irrigation, it can be repaired. No problem. We can repair it.
No. How would you repair them?
I will repair by the Vicryl 2.0
Okay.
or 1.0, which is the strength of the tendon.
What is the ideal method or ideal method of cleaning a dirty wound?
Ideal method of cleaning the dirty wound is that first
You'll
of
go
all, irrigate
okay,
the wound.
but you'll go the
clearly,
clockwise way or the
yes,
anti-clockwise way.
Clockwise way. I will go
Okay.
clockwise way.
Okay, right.
Yes.
So post,
Clockwise is
yes, the orders that you sent post procedure, what were those?
I will give the antibiotic, check the tetanus
Okay.
level, and redo
Antibiotics
the
according to the NHS or trust policy, yes, and then you'll
and
send the
then
culture of the
culture,
swab that you took, yes.
yes, and then I will do the redo operation if after 24 to 48 hours. Again, I will do the same procedure, wound debridement.
You will
It is
request,
needed.
okay, to be done. Would you close the wound or not?
No, I will not close the wound. I will
Yes,
just pack
why?
the wound. Because
yes, what are the low risks and what are the high risks that you can face?
low risk is that wound necrotic tissue again develop, and I cannot see necrotic tissue. Pus formation can occur. High risk that it can lead to a further spread of the infection, like necrotizing fasciitis, so and sepsis. So these are the problems.
Yes, and
So
yes,
and I cannot do the redo surgery properly if I close the wound.
yes. Would you prefer trimming the tail or?
Trimming of skin trimming can be
Yes,
done
can
if it
be
is
done. Okay.
necrotic.
What else have you missed? Once you were done, you were supposed to be disposing of all the instruments that you have
Sharpness.
used. How? Please tell me.
There is a sharpener box is there, and I will throw the syringes without removing it, and blades will be thrown in the box. All the sharps. There are two sharps, like needles and the blades. So, and they will be thrown in the proper sharpener box.
Okay.
Needle cutters in some center, needle cutters are there, and you can cut the needle cutters. It is also a method.
Yes, if it's present, right. How would you confirm if patient has been given tetanus toxoid or not? If patient has not been given, then what would be your recommendation?
I will ask the patient or his relative about his tetanus prophylaxis. If it is not, then I will check which dose is missed. If it is not missed, then I can simply do the tetanus toxoid. And if he did not do the course of tetanus, then I will apply the whole course, and serum, anti-tetanus serum will be given in this case if it is
good.
And
yes.
And if it is so much contaminated, then in this case, I will also give the anti-tetanus serum in spite of the full tetanus prophylaxis.
Very good. Yes. And even if patient or the relative do not remember when they took the last dose, even if they did,
yes,
then also very good. Okay. Thank you.
Thank you.